this country, we think of healthcare as a right, but it really isn't. It's a privilege at this point. And we've let ourselves put together an amalgam of market-based approaches to healthcare, employer-based approaches, entitlements, and there are a lot of people who just don't fall into one of those categories.
On February 29th is when I had my surgery, and I knew that that would be the last time I would ever talk again. If I had gotten it diagnosed a year and a half earlier, I would still been able to have a normal life. This is Commerce City. We're right off of 59th and Magnolia, and I've grown up here all my life. I met my still live in this house. I was gonna try to buy it and make it my own, but right now I have to live in Denver.
Denver Health has open doors, but only if you live in Denver County. If you live 5 feet outside of Denver County, there's no option like Denver Health. You're on your own.
About a year ago, April, I'd been having a lot of trouble swallowing. I thought I had something in my throat. Every time I went to a doctor, they could not do anything for me because of the fact I didn't have insurance anymore. I was working 40 hours a week, working hard. I've always worked well. In the meantime, I'm just getting sicker and sicker and sicker. It was about 14 months before when I first started feeling that I was sick. But after it was 14 months later when I finally got help. And finally I had to end up changing my address and moving to Denver so that I could get help from Denver Health.
She tried virtually everyone in the metropolitan area. So I'm seeing her at a very advanced stage in her cancer. However, I immediately contacted one of our ear, nose, throat doctors, and he saw her that afternoon, scoped her. By the next week, she was having her surgery. But this is someone who fell through so many cracks, it just makes you angry. And that's the type of situation I see, is people just can't get what they need. And if you delay care for something like that, or diabetes, or hardening of the arteries, as patients think of it, you could die without getting the care that you need, or you might receive it at such a late stage that it makes a huge difference.
So right now, the cost of private insurance in the United States for a family of 4 is somewhere around $12,500. The average family in the United States lives on about $48,000 a year. So what you're asking a typical family without health insurance, without help from employers, to spend 25% of their gross income on health insurance in order to cover the family. And simply, that's unaffordable.
I couldn't get to my oxygen because I didn't have enough money, so I had to end up with donations. My family put donations out all over Commerce City. I'd come home frustrated night after night after night, cried. And finally, it was getting to where I got so sick that I had to go and move. I had to move, change my address, and once I changed my address, I had no problem getting help. That's wrong. I just think that is wrong.
Essentially, every other country that is our peer offers coverage to everybody, and they offer it on a per capita basis about half the price of what we offer in the United States. Probably the biggest factor is just the efficiency of the system. So the estimates are that we spend about 31% of the total healthcare dollar in the United States on administrative costs. So we've created this sort of, it's been described as a bureaucratic arms race. The providers have to hire staff to get things done, and the insurance companies on the other side hire staff to try to reduce what's done. And so we spend a tremendous amount of money doing that.
I had this picture. I had film left in the camera, and I was going to take it up and have it done, and I thought, well, why waste 15 pounds? So I held it out, and I took 2 pictures of me being normal. That's the last time I would ever look like that. I still had a voice. I still had a neck. I still looked like a normal person. My neck is now right beneath, and when I
head and neck cancer is often, advanced at the time that we diagnose it. But there are a lot of patients, they were handled on an outpatient basis and they did very, very well because they had limited cancers which were diagnosed sooner. And she could have been one of those patients. But instead, she's someone who was in danger of needing a feeding tube, needing, a major part of her throat resected. So there's just a lot more that goes into your care versus someone who's diagnosed at a very early stage. They become a little bit hoarse one day, we find a small polyp on their vocal cord, remove it, and it turns out that it's an early cancer and that's all they ever need done. And she could have been one of those people.
I don't understand it. I had 14 months of nothing but hell, thinking I wasn't going to be here anymore, thinking I was going to have to die. There's no doctor in Adams County that could help me, that I have to move, and well, I'm right across the street from Denver, but I don't have a Denver address, so I had to move.
We haven't had the political leadership and we haven't been able to develop some sort of consensus as to how to move forward. It is completely crazy, and I don't think anybody who was designing a healthcare system and started to say what is it we want to accomplish with a healthcare system would design the system we have. And so to some degree it's a series of sort of historical accidents that we have the system we do, and there has been there have been several times in our history where we've almost developed a system like Canada or like Germany's, and decided to cover everybody. And because of the mix of sort of politics and sort of social beliefs in the United States, we haven't quite done it.
We'll see you later.
All right. It's inevitable that we change because our current system is completely unsustainable. We have a situation where 1 million to 1.5 million Americans every year are forced off of insurance rolls. The number of people who have inadequate insurance goes up by 1 to 2 million a year, and that may even be accelerating. So we have this bizarre formula where we have the most expensive healthcare system in the world. We spend more on it every year to buy less and less. And that's, you look at those trends, it's unsustainable.
That is why I've put forward a plan that says everybody will be able to get health care that is at least as good as the health care I have as a member of Congress.
Someone like me working in urgent care, trying to do what I do as a part of this system, has a lot of chips stacked against me because there's so many incentives to not provide the care that we're so desperately trying to do.
I just need a signature from you.
Absolutely. One of the fundamental problems is that the market-based component of our healthcare system drives a lot of what we're able to do in terms of healthcare reform. Until we can tackle that problem and say this is social injustice to not provide coverage to 47 million or more people, or to provide the adequate amount of coverage to well more than that, a much higher number who are underinsured, then we're going to continue to have a lot of people going without the care that they need.
There are many hidden costs associated with employer-provided health insurance because they don't reflect all the costs to the employer. And those are reflected in added cost, less wages for the employee.
The polls say that Americans, a large percentage, are ready for major overhaul of the healthcare system. I have to believe we're very close to the tipping point. We're at the point now where the professional class of the United States, the middle class, they're threatened. And I think that's the key ingredient right now, is that perhaps the average American is going to see their self-interest in major reform.
Whatever needs to be done, there are people out there dying. I will always was one of them.
The U.S. spends more on healthcare than any other nation, nearly 20% of its GDP, compared with roughly 10% for most of the industrialized world. That's all for now. We hope you'll join us next time for another edition of We the People.